Hi there, my name is Wes Robinson. I'm the Assistant Chief Nursing Officer for South Texas Health System Heart Hospital, and I have direct oversight of our 6 freestanding emergency departments. And so I want to welcome you to the Rio Grande Valley and to our South Texas Health System. I have just maybe 10-15 minutes worth of information to give you that is very important. So I do ask that you watch this video, take the word seriously, so that we all can be successful and ensure that we're giving the best care possible to our patients. So a little bit about South Texas Health System. They may have covered some of this in onboarding, but we have McAllen Medical Center, which is our level 2 trauma center. We have Edinburgh Regional Medical Center, or South Texas Health System Edinburgh. And it also has South Texas Health System Children's. And it is a community hospital, but also our children's hospital, so it holds our PICU. Then we have South Texas Health System Heart. And Heart does all of our STEMIs, does a lot of open heart, of course, caths, those type of things. Currently, we are trying to keep it clean as we did in our first surge, so no COVID patients. But as we reach capacity, we will certainly open up that facility should it be necessary. And then, like I said, we have our 6 freestanding emergency departments, and I'll talk about them here in a moment since that's where you'll be heading. But let me give you a little bit of a briefing on the COVID situation. So we saw a mass influx in June and July. Our counties had somewhere around, I believe, 2,300 people that have died due to the COVID-19 virus. In June and July, it was very early on. It was kind of after New York City. And so this was when the CDC was first coming out with, you don't have to wear an N95, yes you do, you can wear a scarf. It was every day there was new information, and it was very challenging. It's also a time when PPE was really difficult to get a hold of. So, we were dealing with not just the pandemic, but all the supply chain issues, all of that. And luckily we have a wonderful supply chain team. We never ran out of PPE. We certainly did our best, though, to conserve it. And even conserving can feel really scary when it's supplies that you're so used to just throwing out and getting rid of. So in June and July, I'll give you a good example. Our South Texas Health System Edinburgh facility has a 12-bed ICU, and at one point we had over 50 ventilated patients in that facility. So it really shows you the type of capacity, almost New York style, that we met. Then, after kind of COVID passed, we certainly were having your onesies, twosies, but the general community was worried about coming to the ER. So we weren't seeing just our normal abdominal pains, stub toes, sinuses, those type of things coming into the ED setting, and our volumes dropped considerably. So ERs that would normally see somewhere around 70 patients a day, we're seeing in the 30s. And some of ours that would see in the 30s, we're seeing in the teens. Within the last about 3 weeks, a lot of our normal volume has returned, but so has COVID. And so our facilities are not at maximum capacity at this time, but we are certainly seeing an upwards trend. And that is where we need your help. We do believe that we're going to be probably in, hopefully not a repeat scenario, because our last scenario was very difficult, but we are going to be in a difficult spot very soon. And so that's why we're really glad you're here. We welcome you. We had over 200 crucial state nurses within the system during June and July. We had a number of travelers that came. So some of you may not be here with Crucial, but we'll be here with another staffing agency, and we're really glad you're here. You're an intricate part of this team, and I want to make sure that you succeed and that we give the best care to our patients that we possibly can. So that's why we're gonna go over some information. It's not to be threatening or to feel negative, but it's just so that we're all on the same field, the same playing field, and we know where we're gonna start and where we're gonna end, and we'll end with success. So a little bit about our freestanding ERs. We have 6 freestanding ERs. They are fully functional emergency departments. They hold stroke certifications, they hold chest pain certifications, they see a lot of EMS traffic. So you will see your cardiac arrest. I mean, EMS will bring us pretty much anything unless it's a truly like known stroke perhaps, and they can go to the stroke center, or it's a really large trauma. But we still get, because we do have farming communities, quite a few of walk-in traumas as well, burns, even birthing of babies. Probably this system's the most births I've seen in an emergency department than any other system I've worked in. So you'll see a lot of that. We have a full lab that is staffed with a lab person. We have a picture that's stocked by our pharmacy every day. But we don't have phlebotomy. So all lab draws are done by nursing. We also don't have RT, which means that you will be assisting with sets up of the ventilators. So please, we have videos on how to do that. You'll also be covering that in your orientation. So if you have any questions, just really get familiar with those ventilators. During our last COVID surge, the state sent ventilators, we rented ventilators, we had a lot of different machinery. So please do your best to familiarize yourself with what we have. And if you have any questions, we're always about getting a cheat sheet, getting a video together, something so that it's always readily available if you have any questions. Not having RT also means that you would be doing your own breathing treatments. So while we may not be seeing holding patients right now in our ED, this may be something that begins to occur as we have patients on BiPAPs or vents that are holding. In the past, we did not hold a lot of vents. We held a lot of BiPAPs, but we did not hold a lot of vents. And we held a lot of patients on high flow oxygen. So we do our best to facilitate the vents out of the facility. Like I said, right now, there's no issues whatsoever. Most patients will not hold more than 6 hours. That is our goal, is to have a patient in and out within 6 hours if they are an actual admission. What else? EVS. So each facility does have EVS. They're not always there for 24 hours, and they are working on the facility. So we do turn our own rooms. So ensure that you're cleaning your room properly, that you're following the instructions on the cleaning supplies, that you're doing touch surfaces, side rails, all of those things to ensure that we have a really clean workspace. We all know that us nurses are not all the same when it comes to cleanliness. So some of us leave a heap of trash after starting an IV. Some of us always throw it away. Just try to keep your rooms tidy so that turning of rooms will be much, much easier. All right. Okay, so let's talk about some of the must-haves. Like I said, we had over 200 staff with us last time, so we've had a lot of experience of having people from all over the United States come to work with us, and that's been awesome because we've made a lot of friends, but it's also showed us a lot of places where probably if we had better communication, it would have been a better working relationship. And so those are some of the things I want to share with you. Charting. If we get into the place where we're having multiple holds, the EDs have turned into mini hospitals, then our charting probably will change. It will not be as we would normally do in an ER setting. But at this point, we're simply not there. So it is expected. Hourly vitals, your assessments, just your basic ER charting like you would do at home or anywhere else. So please, look at your Cerner training, ensure you know what's going on. And then in your orientation, try to be as hands-on as possible with the EMR because charting is going to be expected. If we do change, you will be notified. Certainly if we go into inpatient charting, sometimes we've done some things on paper to make it easier for us. But right now, we're not seeing that type of volume. We're not seeing those type of holds. So charting will be normal ER charting. Vital signs, like I said. So all those pull from the actual machines. We're really lucky. We have some pretty good technology. So no excuse why there should be long periods of time with no charting or narrative notes that are not there that don't paint the picture of what's going on with the patient. Remember, we always chart like we're going to court, right? That's what we were told in nursing school, and that's very important. So please look at your chart. Scanning of medications. Okay, this is a big one. It is very important that you scan your medications. We want 100% compliance. Of course, there will be times when the barcode can't be read, et cetera, but just because you're a traveler, just because you're a state nurse, is not an excuse not to scan meds. And let me tell you why. Scanning of meds is part of the 5 rights. And honestly, it is that that safety barrier after you've performed your 5 rites. It's that extra level of comfort that you do not cause harm to a patient, especially with narcotics. It's another thing. You know, there'll be people next to you who may struggle with certain things and who may struggle with abuse. And we do not want to be an open medicine cabinet for people. We want to ensure that the policies are there in place, that we're following them, that we are a deterrent, that people can come to work, and if they're struggling in that manner, that they don't feel pressured or feel like it's super easy. You know, we've heard those stories that have happened in New York City, so many vented patients and just narcotics, you know, being brought in boxes and bags. Our narcotics will always be locked up. They will be into Pyxis, and it is expected that there is an order for said narcotic, that it is documented that was given, and it's documented via scan, and if there's a waste, that the waste is done properly. If you go to the Pyxis and there's a discrepancy, it needs to be fixed immediately. So please contact the charge nurse and we will fix it. Again, this is no ifs, ands, or buts. We usually do 2 or 3 strikes, you're out. And I just say that so that we all understand that that's the policy, that's how we're gonna work, and there's no questions on that. So in your orientation, please make sure you understand the policy on narcotics, that you understand how to scan, and that you're really paying attention to it, because it's very, very important. All right, cell phones and earbuds. So it's 2021. Everyone's always gonna have their cell phone next to them. I understand that. It is not appropriate to use your cell phone, be talking on your cell phone at the nurse's station. It's not appropriate to be talking on your cell phone with a patient. We consider that a HIPAA violation. There are people talking about patients. There's phone calls being made, especially if you're in a patient's room. And so that means no earbuds. You don't want to see earbuds. There will be no earbuds. It's just not going to happen. So, you're welcome to use the phone, use your earbuds on break, at lunch, those type of things, but we do not want to see them in your ears while at work. Honestly, it's just rude. It's rude to the patients. Patients deserve 100% of our attention while we are delivering care, and that is the expectation. All right, sleeping. So you guys are working a lot of hours, no question. If you're getting tired and you need a break, please talk with your rep. Get a break day. We are more than happy to ensure that you are getting rest days. But of course, that is between you and your company or BCFS, whoever is kind of overseeing your hours. With that said, there's no sleeping at work. So if you're working night shift, it's slow, clean, make sure we're regulatory ready, make sure the rooms are stocked and ready for patients. Look and see if we have supplies that we're low on that we may need. Again, we're a freestanding ER, so sometimes it may take a little longer, to get supplies. So please do not sleep. It's simple as that. And holding. Should we begin to hold patients for long periods of time? And I'll tell you, in June and July we did. Each freestanding pretty much became a mini hospital of sorts. We admitted patients there, hospitalists saw them there, and we discharged them from there. And of course, we all know an ER is not an ICU, and it is not an inpatient bed. But we need to do our best to ensure that those patients are receiving the same quality of care possible. That means turning, which we should be doing in an ER setting anyways if the patient has mobility issues. Turning those patients, ensuring they've got proper, whether it's Mepilex or whatever it is, on their bony prominences to ensure no skin breakdown. If they're there for a long time or going to be held for several days, Hibiclens baths are super important. One thing we've learned nationally, is that as we wear the same PPE, so there will become a time, right now currently the ERs are N95 and face shield, but there will become a time where we will consider the ER hot at all times. So we do have Tyvek suits for your use. We also have gowns. A lot of people use the Tyvek suits, and it is an easier thing to wear during your whole shift. The problem is you can spread other things other than COVID from patient to patient. And we know that there are all kinds of things. And so wearing the same pair of gloves is just like not washing your hands, right? So we need to ensure that we are doing proper hand hygiene between patients, that we are changing our gloves between patients, and that we are giving Hibiclens baths to those patients who are staying a long time so that they are not getting any kind of resistant bacteria. That's something new we've seen nationally in wards, because wards is, it's kind of a thing of the past in the United States, but we're seeing where people are using the same gloves, going from patient to patient to patient, spreading other types of infection. Proning. So again, we were new in June and July. We probably didn't prone the way as much as we should, and so we want to be more aggressive about proning this time. You will have patients who will present in the low 90s, who are mobile. We have patient information handouts for them, both in English and Spanish, so that they can learn how to prone themselves. Even those patients you're going to discharge home who perhaps have bilateral pneumonia, think about those guys. Keep them off that BiPAP, keep them off that vent. We've learned that if we can prone and prone aggressively, we do keep people from decompensating. And so I ask you, that is a nurse-driven function. You don't need an order. Please, please, please see yourself as a nurse educator and work with those patients so that they have the best outcomes. We want the best for our community. We've done this once. We don't want to do it again, but it looks like we may be. And so we're going to do our best to learn from the past and to do a much better job this time. We gave it everything we had last time, but we're going to step it up this round. And so we're really glad you're here. I want to thank you for coming. I ask that you'll be compassionate to our community, that you'll be compassionate with your coworkers. Like I said, the people you're going to be working next to, perhaps you've been working a state job or agency now for a while, and you've been caring for COVID patients for weeks and months and months and months. Know that the South Texas Health System staff have been doing the same thing. And so show each other a little bit of compassion, a little bit of kindness. If you have any questions, I'm available 24/7. I'm not the director of your facility. Each facility has a director, and they are available 24/7. But if you feel like there's a need that's not being met, if there's something clinically that we need to do better that you see, if there's supplies we don't have, any needs whatsoever, please do not hesitate to give me a call. My number is 865-809-8142. That's 865-809-8142. And like I said, you can text or call me 24 hours a day. Again, welcome to the Rio Grande Valley. Welcome to South Texas Health System. We are glad you are here.